surgery, the first one. He said that it is responsibility of technology to deliver better care. And Chris Farmer, who is the Associate Medical Director at East Kent Hospital NHS, said that large organizations should not have problems with failure, because failure is common when implementing innovation, and it should keep on trying. There were further concerns in the sense that there was need for training of digital health transformation to healthcare personals. There was a need for honest brokerage who could facilitate the sale of these innovative ideas and technologies. There was a need for a standard evaluative framework for digital solutions. So other concerns were there was need for doctor involvement. So all the digital health initiatives and startups were doing everything on their own, and the physician's perspective was not taken into consideration. There was also concern that an average user has got 14 apps which they use regularly. Whether the insurance company or your digital health app will make in their collection or not, which was an important issue. Whether it will be as ubiquitous like Facebook. There was also a concern about the big data, because they said that big data necessarily doesn't mean that it has got smartness in it. The efficient use of data was important. So I could conclude that the big concerns was very aptly put by Esther Dyson, who is like the, I think the founder of Wellville in US. She said that healthcare is sick. Episodic, what you call pilots, will not lead to change. She wanted some radical redesign or radical transformation of the whole healthcare system. And this thing that the innovation to barriers to innovation in healthcare were because of varying camp license, the analytics were not actionable, and there were a lot of diverse systems which the innovators had to take into consideration. But there were good hopes, since one of the Ipsos finding on healthcare was that in 2015, 3% of them paid online for digital health, while in 2016 it's 8%, it's jumped 5%. And the same gentleman, the innovative surgeon who ruled Google Glass, said that devices can connect us in a better way. Tech is a better way to communicate between clinicians and patient. And I will leave you with some rules and humor. The rules were doing the rounds there. You can read it for yourself. While the humor was that, Europeans love to regulate while Asians copy and Americans make business out of it.